Well, I know everybody on this call, but for the sake of this recording, um, hello and welcome. So, my name is Melissa Jimenez. I am the founder of Making Strides. I'm a veteran, a lung cancer survivor, a certified personal trainer, nutrition coach. But I'm really glad that you're able to join us today to really talk about heart health in motion. So, we're looking at some strength training and smart training in general for blood pressure, cholesterol, longevity. So, this session is all about practical, proactive steps for protecting your heart um, and supporting long term wellness. So, you're going to hear both a medical perspective and a fitness based approach. So, hopefully, by the end, you're not only going to understand the why the heart numbers matter, but also how you can use movement to improve them. So first, you're going to hear from Dr. Aaron Block from the Cove Concierge Medicine. He's going to share what the key heart numbers mean, when to be proactive, maybe about your labs or your blood pressure, and then really how to develop or how prevention plays a key role in longevity. I'm then going to return to kind of walk you through how to turn that knowledge into action with some realistic exercise strategies that really fit any schedule or fitness level. At the very end, with the time that we have remaining, we will wrap it up with a live Q&A. So if you have any questions along the way, you can put them in the chat. We can potentially get to them during the presentation, but if not, we'll definitely answer those at the end. And then, of course, you can always come off mute at the end as well to ask any questions that you might have. So this is a very relaxed, community-based conversation. So feel free. Some have already said hello, but feel free to say hi in the chat, kind of share where you're coming from. I believe everybody on this call is in Colorado. We do have some registrations from other states, but does not look like they are joining. So with that, we will go ahead and get started. So Dr. Block, the screen is yours. I will stop sharing.
Good. All right. I think we have that good to go. All right. Can everyone see my screen okay?
Yes.
Beautiful. All right. All right. So everyone, I'm Dr. Aaron Block. I am a family physician and CEO, co-founder of the Cove Concierge Medicine, where our goal is to get back to being able to educate and talk with patients and help everyone understand why do we do the things we do in healthcare. A lot of it seems very transactional anymore. There's not time to get in and ask the questions that you need to ask. And so when we're telling you about, a diagnosis or a plan, or when we're telling you to do things that are to, be wellness oriented and preventative, if you don't understand why we're doing what we do based on science and understanding, it's hard to actually follow those orders, so to speak. And 30, 40 years ago, no one ever questioned the doctor. Now we like to actually have conversations with our patients to engage them. That requires time. And obviously the American healthcare system hasn't figured that system out super well yet. So thank you for coming to this talk. What we're going to talk a little bit is kind of an overview about talking about how cardiovascular and heart health changes as we age. When we're very young and in developing, things are usually on their way up in terms of health and progression and change. And then as we hit the other side of 40, 50 and onward, we actually see specific changes. And we're going to talk a little bit about the differences between men and women, which are oftentimes mitigated by our sexual hormones. So for women, mostly estrogen based, and for men, mostly testosterone based. So let's get started in talking about how do we understand what is changing in our bodies? How do we discuss and clarify when we're talking about cardiovascular health and risk? What does that mean? And then let's do something about it. So, what changes in cardiovascular risk? When we're talking about risk, we're talking about the opportunity for things that we don't like happening getting more common. So, when we talk about cardiovascular disease, we're talking about the heart and then all of the blood vessels that go along all the body. And if you can imagine, everything that we have in our body is all part of that cardiovascular system. So, a couple of the physiologic changes, what actually happens to our body and our organs, our blood vessels become more stiff. And when we're young, kind of think about what's going on when you look at little kids and you pinch their skin, right? They don't have wrinkles, they don't have tons of moles or freckles. You pull it and it seems very tight and it goes back to its normal form. And then think about your grandparents. And I know a lot of kids love to pick the top of the hands of their grandparents because that's where that skin kind of gets older and thinner quick. As we get older and we change those, the age of the tissues and the collagen levels don't get replenished as well. Same thing happens with a lot of our organs and our blood vessels on the inside. And so that changes as we have more stiffness in our blood vessels that actually will tend to increase blood pressure as well as risk of injuring with the velocity of the blood. Insulin resistance also rises. Insulin is our chemical signal, one of our hormones that tells our blood cells, or actually, I take that back, not even just the blood cells, but basically any cell in the body, to pull the glucose or sugar out of the blood, the liquid, and into the cell to be metabolized. Sometimes as we age, other people, differences in speed and metabolism and our general health, but the signal to insulin stops responding as well. Or sometimes our bodies have problems actually making that hormone, insulin, in and of itself. We generally see, though, as we age, we do not respond, our cells do not respond as quickly or as efficiently to insulin. And that's how blood sugar levels start to rise. And then as blood sugar levels increase, think of that kind of as rust. As you're circulating around the whole body and you have sugar and glucose that's kind of hanging around where it's not supposed to be, it'll kind of attach to things and basically degrade them. So as sugar levels increase in the blood and attaches to the wall of your blood vessels, it'll actually start to break them down. As we age as well, we see changes in body composition. A lot of times our general metabolism starts to slow. So we start to put on more weight, especially around the abdomen. We talk a lot today about visceral adiposity, which is the fancy term for the actual fat that sits on our organs. We know there's a direct correlation between how much fat we have on our organs and the amount of inflammation we have in our body. And that inflammation in turn also increases risk for bad things happening like heart attack, stroke, and other outcomes that we don't like. Also, very interestingly, that as we get older, we know that our autonomic system, so basically part of that is our sympathetic system, our fight or flight, seems to turn on more than our parasympathetic or our rest and digest system. That seems to impact sleep. And also, when we don't sleep, we don't recover from activity. We don't rest. We know that when we sleep as well, when we enter those deep stages, we've actually learned within the last 10, 15 years or so, that's when our brain actually goes through the process of taking out the metabolic waste. So by not sleeping, that's kind of where you get the brain fog, that continuous fatigue. All of these things all together, unfortunately, add up and increase our risk for bad things happening. What we're going to talk a little bit about today, because we could spend hours in this subject, is talking a little bit about how does it change between men and women based on our biological sexual hormones. For men, we tend to see spikes in testosterone, or rather not so much spikes, but peaks, high levels in gentlemen in their late teens and early 20s. And as you can see in this chart, over time, in every decade, we see those levels start to deplete. Now, again, remembering that every single human has their own experience, and that's why we are pushing a lot for personalized medicine in today's time. Just because we see an average or a trend doesn't mean that everyone behaves along the trend. But typically, in 20s and 30s, men have pretty strong, robust testosterone. In that mid to late 30s and early 40s is when we sometimes see this transition. And, the longer that we age, the more that those levels drop. Testosterone has a lot of function for lean muscle mass, but for mood, for energy, obviously sexual function as well. So a lot of different purposes in the body. Some guys can make it their entire lives and never be very symptomatic from that. For other individuals, I've met gentlemen in their 20s that actually need to have testosterone therapy because their testes stop making that normal amount. Kind of similar to what can happen to women and ovarian function. But as you can see, these changes that do tend to be gradual over time. So men over time have kind of a smoother transition into cardiovascular aging. When we talk about that for women, however, um, you know, estrogen, changes are very different. So unlike men, where the testicles produce both sperm and testosterone and kind of have a spike early in 20s and 30s, and then, over time, typically more of a gradual change, women have very different patterns. The ovaries are what create estrogen and progesterone in the body. And actually, the eggs that come out of the ovaries are usually what generate the estrogen. It's the corpus luteum, or the sac, that controls, or basically where the egg sits. And that's where the source of main progesterone comes from. Usually those estrogen levels start to peak when women hit menarche or have their first period. And then that estrogen phase usually stays active until within about, the average length of time is about 12 years or so. And that's the perimenopausal time. That is when estrogen levels can actually go up and down and spike. And oftentimes why women experience symptoms in a non-linear fashion. Also why we don't love to chase labs in this population, because chasing labs when these symptoms are going up and down can oftentimes give us, false information. But with the volatility here, we've also seen that when women hit menopause, it is a strict, low decline of estrogen without any more change. And so that leads to a very abrupt and fast change in cardiovascular health for women. When we're talking about this, regardless of, sexual, or biological sex, the numbers that we talk about with patients and we start early and chase are ones that can help us modify our risk. So while aging is difficult, it does not mean that it is basically a death sentence. And so there are things that we can certainly do. Blood pressure, the amount of pressure that we see when the heart squeezes, the top number are systolic, and the bottom number is the diastolic when the heart relaxes, definitely changes how much pressure and how much wear and tear we're going to see on our organs and our blood vessels. Making sure that blood pressure is monitored, and that if it gets higher, doing things to help lower blood pressure also modifies that risk. In terms of looking at lipids, cholesterol levels, the bad cholesterol that we typically think of as LDL, or non-HDL cholesterol, that means low density lipoproteins. These are the fluffy cholesterol particles that when we have turbulence, inflammation, or damage to the blood vessels, as the body is trying to repair that, oftentimes seen in high blood sugar or high blood pressure situations. This is the stuff that loves to sneak in and incorporate itself into the walls of the blood vessels. And therefore, creates a process called atherosclerosis. This is where we start to see narrowing of those blood vessels. A couple of other labs that are important within that lipid family are triglycerides, which are the sugary fat molecules that also have their own risk. And then one that is becoming much more, accepted as an important thing to look at is lipoprotein A. Lipoprotein A is something that a lot of my patients have not heard of, and I only started testing within the last 2 years or so. This is a genetically controlled cholesterol molecule that also can be a complete independent risk factor for heart disease. What that means is that even if we check your LDL and your cholesterol looks good, if we don't know that you have a genetically high special cholesterol level of the lipoprotein A, that is something that we could intervene in. There are some medications that are on the pipeline within the next 2 or 3 years, but usually if someone has an elevated lipoprotein A, we are a lot more aggressive in trying to lower their LDL to help with that risk. Glucose, blood sugar, something that we take a look at. And the A1C measurement is a 3-month average snapshot of where your blood sugar is hanging out at. So that also gives us an idea for how to modulate risk there. BMI, body mass index, is a tool that we use. It's a contextual tool. It's not a perfect measurement. I have bodybuilders that I've taken care of, in the past that are, technically morbidly obese and they don't have any body fat. Waist circumference is a more important marker where we actually measure kind of around the hips and the belly button. This gives us an idea truly of kind of the impact on fat in the body and the risk that comes with that. I love to show this diagram from the Cleveland Clinic. This is basically the perimenopausal, menopausal woman. Most people don't realize all of the things that estrogen influences in the body. And even more so, estrogen is also really important in terms of certain functions in the male body as well. Obviously, women were not designed equivalently. So, females tend to have more receptors in their body that are a lot more sensitive to their estrogen levels. The big things that we're talking about today: changes in the low density lipoprotein, or the LDL, and insulin resistance can often rise without major changes immediately. So while weight may change, weight may look stable, doesn't necessarily mean that metabolism has changed. Some women will see that they start to have a little bit more fat content in their abdomen. They may notice a little bit more subjective or sometimes objective weakness. And that has a lot to do with the drop in estrogen and the changes in regulation of, how do we manage sugar? How do we build, bone? And a lot of times the symptoms will pop up before we actually see abnormal labs. So a lot of the work that we do in perimenopausal and menopausal care is following the clinical, or how does someone actually show signs and symptoms, not necessarily a lab test. And that's why, unfortunately, there are a lot of women out there where risk is not caught early enough or mitigated early enough, even though we have the science to basically show us what to do better for people. Obviously, I want this to catch your attention with a red slide. What are the symptoms of cardiovascular aging? When your capacity changes as we get older, as the tissues start to age, as we start to see changes in insulin sensitivity, in your cholesterol levels, in the elasticity of your cardiovascular tissues, the more common things that we'll see pop up is all of a sudden a declining exercise tolerance. Think about, how active you were, at 16, especially if you're playing athletics, and then think about watching somebody as they're 65, not usually the same amount of, ability. And again, not every single patient runs the same course. So I've seen 65-year-olds that are in better shape than 16-year-olds. But what we generally see as a population is that as individuals age, their ability to tolerate and to perform exercise decreases. After doing, activities, more breathlessness, more time to recover, feeling way more, exhausted or overexerted after activity. The other thing that we see a lot more of as people age are palpitations and the changes in variability in heart rate. Usually, we want to see that the heart rate is rather variable, so that when you need more activity, and more oxygen circulated, it'll speed up real quick, but it'll also go back down when you're at rest. We don't see that ability to adapt nearly as well as we age. Less common signs of cardiovascular aging, as well as more concerning signs, are when we have patients or individuals that experience chest pressure, tightness, dizziness, feeling lightheaded. Also, something that people don't realize, exercise associated nausea, that counts as basically a heart symptom. A lot of times when the heart is working a lot harder, it'll pull blood flow from other organs. And so sometimes that in and of itself can be a red flag. So, again, where's the good news in all of this? The good news is that we can always do things to improve your risk. Sometimes they're not easy, and sometimes they're not what everyone loves to do. If you can train yourself to make it part of your life and make it something that is about taking care of yourself, it becomes easier to manage. Resistance training is one of the biggest, hottest items in terms of not only preserving muscle, but also in terms of preserving bone density. We really want to stress the muscles and we want to stress the bones, good stress, but that's basically how we trigger the body to keep organs, and in our body building. If we don't, if the proverbial saying, if you don't use it, you lose it, is very true. And unfortunately, one day being sick and laying on the couch, you have the potential to lose up to about 10% of your lean muscle mass, which really sucks because it takes a lot longer than one day to build 10%. But that's, again, how our bodies are designed. Nutrition, what you put in the gas tank, is super important. For car enthusiasts, you don't want to put ethanol 85 in your Ferrari. It's just, why would you invest that money? Same thing in our body, putting in processed, crappy food, not well balanced nutrition. You can't expect to have an optimal machine running otherwise. Cardio exercise is super important for training the heart and vascular health. Cardio plus resistance is really where Melissa's going to get into talking about how important all of that is. And then just as much as actually the good stress of the body is also the taking time to let it rest and recover. So making sure that sleep is optimized, and making sure that you have adequate time for recovery. There's the 5 pillars of wellness are basically my personal things that when I'm working with patients for wellness and talking about their annual exam, diet, exercise, sleep, sex, and mood are all of the things that I look at in terms of really helping bring quality and basically the lifestyle changes that I want people to focus on for better outcomes. On our side, what do we do? When you work with us and when we talk about diet, exercise, sleep, sex, and mood, a lot of these are screening for potential risks that we need to help identify with our patients and make those changes. We also know that, when we talk about in primary care and family medicine, which is my specialty, early intervention changes those risks. If your blood pressure is through the roof, in your 20s and all the way on, your risk of having a heart attack, stroke, or other major problems to the body much, much higher than someone who has maintained better, or controlled blood pressure throughout their entire life. And then in addition, it's also everyone's individual body and individual, life. So while I can't, force anybody to really make sure that they do all the things they need to do for their blood pressure, it's something that we need to basically make decisions together. And that's the best tools to help people, thrive. So a little blurb on hormones and heart health. It's very interesting. Estrogen actually shows that it is rather protective for women's heart health. We do not have an indication for prescribing estrogen just for heart health, but there are a lot of things that would give us reason to consider estrogen supplementation. the type of estrogen that we give, how it's delivered, whether it's through transdermal through the skin, whether it's oral, whether it's injectable, whether it's vaginal, all matters. And it's also important to know in this day and time, it is hard to get clear answers about, well, is it safe to do it? Is it unsafe to do it? What is my personal risk? Everyone's risk is very individualized. So making sure that you speak with someone that actually knows the data and can help guide based on what the best decision is for you and your body. For men, testosterone in and of itself, it's questionable. We don't have super clear data on the long-term benefits. We do know that testosterone is really important for helping us maintain lean muscle mass in men. But we also know that there's been this concern that testosterone is dangerous for the heart. Some of the trials, like the recently that's called the Traverse trial, has actually shown that the cardiovascular risk, we used to think that testosterone, increases risk for heart attack and stroke, actually shows that it's pretty neutral. So it doesn't make anything better, but doesn't necessarily make it a lot worse. The other thing that I caution in this is actually trying to replace testosterone in men that, one, are symptomatic and need it. Two, is also really important to understand that we're keeping them in a normal physiologic range. That's why some of the treatments and methodologies are giving too much of any of these hormones multiplies the risk of all the bad stuff happening significantly. So it's, again, really important to talk with a provider that can have the discussions about the good, the bad, the ugly, and figuring out what our goals. And anytime that we are using any type of treatment, there is the cost of doing treatment and the cost of not doing treatment. So it's really important, and I really encourage patients about that shared decision making and understanding why we do things the way we do and figuring out what's right for you. An interesting point that I want to talk a little bit about, the data on aspirin kind of goes back and forth and has changed multiple times over the years. Back in 2022 is when we had a couple of changes. We used to just tell everyone at a certain age, we take aspirin for protection against heart attack and stroke. What we also found when we really looked at some, large amounts of data is that the risk of bleeding from taking aspirin sometimes was more than the benefit you would get from taking it. So as of now, in this day and age, and I find that still a lot of people are not aware of this, we do not globally recommend aspirin to everybody for cardiovascular protection. We usually use it as something called secondary prevention. So for example, if you are someone with diabetes where we have problems with your sugar control, we know that the data shows that taking aspirin will in fact be better in terms of the benefit of helping prevent a heart attack or stroke rather than the risk of having a bleed with that treatment. So as we're transitioning over to the next part of our presentation, one of the things that Melissa and I really, feel strongly about and wanted to discuss is thinking about exercise as your central defense agent for cardiovascular aging. We know that it improves endothelial function. Endothelial function is the inside of the blood vessels, keeps it healthier, keeps it more flexible, helps actually fight some of that stiffening and hardening. We know that exercise specifically through a lot of different mechanisms reduces inflammation. Inflammation is our body's process of trying to heal things. And while some inflammation is good, a lot of it is very bad. And exercise is one of those great normalizers to make sure that we lower inflammation in the body. Exercise also increases insulin sensitivity. As you're using more and more energy, your body actually trains to be more efficient in terms of pulling sugar, again, out of the bloodstream and into the cell, and actually listens to the insulin, hormone stronger and helps, maintain that sensitivity. But preserving muscle mass, improving autonomic balance, the rest and digest versus the fight and flight systems, as well as enhancing the mitochondrial function. And those are our powerhouses within the cell that help us create ATP, which is our major currency for energy. So questions that I want, people to think about and, reaching out with their healthcare, team and their wellness team. What is my current trajectory? Where do we look at in terms of your muscle mass, your insulin levels, your blood sugar levels? Um, are we sleeping well? What does our, nutrition look like? What does our sexual health look like? What is our mood and anxiety? In this day and age, we want to have honest discussions about how do hormones and how do labs factor into that risk. And then what do I need to do in terms of, making sure that my lifestyle is really supportive of the goals that I want to see forward. And so with that, I have a list of some references if people want to do some deeper dives. And I will turn it back over to Melissa.
Thank you. Share my screen. Oh. Okay. Camera. Beautiful. So I'm not going to talk too much on this specific screen because we just went through a lot of the information from Dr. Block. So just to kind of reiterate why movement matters so much for your heart health in general. I mean, when we move, and it could be a brisk walk, it could be resistance training, it could even be playing with your kids. It's your heart is going to learn to pump blood more efficiently. And then that efficiency is going to lower your resting heart rate and your blood pressure over time, right? So again, some of the benefits of movement, it raises the HDL, so the good cholesterol. It can help lower LDL. And that's the one that tends to really clog arteries. So that's a good thing, right? We want to lower your LDL. And it keeps your blood vessels flexible. And as Dr. Block mentioned, it improves the insulin sensitivity, right? So it's all good things. But the good news, you don't have to train like an athlete to make progress. So research shows that even short, consistent, again, consistency, right? You're going to hear that a lot, consistent bouts of moderate movement. So even 5 or 10 minutes at a time can create some pretty impactful and measurable improvements. So what I like to call my method is SMART training. So it's really training that's structured, but it also provides some flexibility in there to fit real life. I understand that people get busy. You can't always do the same thing at the same time every day, especially when you have a job that is flexible. Things come up, they change. You might have kids, right? Their schedules are constantly going to change. Things are constantly going to come up. So having this training method is going to help to really solidify and kind of block off some time for yourself and for that mindful movement. So SMART stands, of course, it's an acronym. So the S is for sustainable. It's something that you can do week after week, right? Something that you can do all the time. It's consistent. M is measurable, right? So I want you to track any small wins. So it could be the distance, right? It can be how far you went on your walk. It can be time. So maybe you did 5 minutes, maybe next time you did 10 minutes, right? You doubled the time. That's it's pretty impressive, right? That's a lot. So thinking about time, energy, so your energy levels. So RPE is your rate of perceived exertion or rate of perceived effort. So on a scale of like 1 to 10, how much effort did it take to do that activity? If you're at a 2 where it's easy, you're chatting, it's not really requiring much energy, but then maybe the next time you do it, you're at like a 6 or a 7 where it's a little bit more challenging, then that's a win, right? You increased that energy level that you're putting into the that exercise or that workout. Um, Another small win is consistency, right? Like, how often are you doing this? Are you able to stay consistent? Um, Dr. Block mentioned even one day of laying around on the couch, not doing anything, it's going to have a pretty significant impact on those gains that you have been working towards, right? So, having that consistency is key. You don't want to really push yourself super hard, get burnt out, and then do nothing for a week or two, and then go back into it. So as long as you have some consistency in there, you're going to see some improvements. The A is for active variety. So I like to look at this as a mix of cardio, strength, and mobility for a more balanced approach. Depending on the client, depending on the age, of course, we talked about individuality. So everyone's program is going to look a little different depending on your needs. If your heart health, I do a cardio assessment with all of my clients. And so if I find that your heart health is not where it should be, then we're going to mix in some cardio. If your heart health seems great, your cardio assessment was amazing, then we're probably going to focus a little bit more on strength, mobility. And then if balance is an issue, we might work on some balance exercises, right? So a lot of this is going to help with that cardio activity. Even strength training, if you do strength training and you're not, going and running 5 miles, strength training can still be cardio in the sense that cardio is just elevating that heart rate, right? We want to elevate that heart rate, get it up, and then let it come back down, do it again, right? So a lot of that interval training, and that's going to help strengthen that heart. So I don't want people to feel that you have to run, you have to do the elliptical. Those are some of the traditional cardio equipment and cardio things that people do. But strength training also helps with that cardio health as well, especially if you do a superset. So you do one exercise right after another without a break between, and then you take your break and then you do it again. That is going to increase your heart rate just going from one exercise to another, even if you're not doing it for speed, right? So mix up your exercises. And then the R, realistic. So I want you to match it to your schedule and your lifestyle. Everyone's schedule is going to look a little different. Everyone's lifestyle is going to be very different. So make it realistic for you, something that you can actually maintain throughout your life, really. And when I say throughout your life, just know, as we talked about, as we age, things have to change. You have to mix it up a little bit more because everyone's going to need something a little different as our hormone levels change as we age. So just keep that in mind. What you're doing today may work really well for you, but that might not work well for you in the next 3, 5, 10 years. So make sure you're constantly kind of checking in with yourself, your healthcare providers, to make sure that you are still on the right track and seeing that right trajectory. And then the last one is T for targeted. So I want you to focus your training around goals. So whatever those goals are, make sure that it's targeted towards that. So you can look at maybe your blood pressure. You want to focus on lowering blood pressure. Great. Let's make sure your training is around lowering your blood pressure. If it's about stamina, like you just want to not be out of breath, right? Going up and down the stairs. Great. Let's target and let's focus your training around your stamina. So pick one small goal and work towards that. Once that goal has been reached, great, let's find another goal. And we just keep reevaluating and coming back to this. So that is the SMART training framework. That is what I use most often with a lot of my clients. So for heart health specifically, we want you to aim for at least 150 minutes weekly of moderate activity. So again, think of brisk walking, cycling, swimming, doesn't really matter. All we want you to do is increase that heart rate. So moderate activity just means that you are able to still carry on a conversation, but it might be a little challenging for you. So you're kind of out of breath. So I don't want you to think that moderate activity means that you are, running and it's hard to catch your breath and talk to somebody. That we don't have to push that hard, right? So moderate activity. So you can still carry on a conversation, but it's a little challenging. And that conversation can maybe be like a couple sentences, and then you got to stop talking for a minute, and then continue that conversation, right? And then look at adding 2 short strength sessions for your muscle and your vascular support. So I know that can seem like a lot, which is why I recommend you break it up. If you can't do, an hour here and there, then maybe do 10 minutes 3 times a day, right? It's just as effective as a single long session, as long as you are committing and putting in the same amount of effort for that 10 minutes as you would for a 30-minute session, right? So break it up. I put in on this slide here just the idea of time blocking. If you haven't heard of it, it's basically just taking your tasks or things that you do and putting it on your calendar in certain time blocks. You get a lot more accomplished this way than jumping back and forth between various things. So you'll see the column on the left, that is all the things that you do in like 5 minutes here, 10 minutes there, a half hour here, and then you go back to this 5-minute thing and you're all over the place. If you block it off for a certain amount of time, and that is just what you're doing that day, then you get a lot more accomplished in that time because you're focusing on one thing instead of your brain trying to go back and forth between various activities. Because studies show that it actually takes more time to understand where you left off and where you're picking things up than it does if you were just to do it for a longer period of time, one time throughout the day instead of 5 or 6. So think about, putting your movement activities on your calendar to kind of break things up a little bit. All right, so how can you make smart training happen? Really without expensive gym or tons of time, because again, we know time is limited. It's a limited resource. So I want you to do a mobility minute every morning before you have your coffee. Just think about movement, right? Mobility, movement. So 1 minute of intentional movement before you have your coffee. And then swap one of your like 15-minute scroll breaks on, social media for doing a quick walk. A 15-minute walk doesn't have to be far. 1 lap around the block, maybe go to the end of your street and back, but just 15 minutes. That can even be in the house. I know in some parts of the country, it can get cold outside. 15 minutes walking the house, go up and down the stairs. The next one is, really try using maybe music playlists to time your workouts. So think about like 1 upbeat song could equal about approximately 5 minutes of steady walking or movement, right? So try not to make it so daunting, and use something like a song where you're like, okay, I am going to walk for 2 songs. Great. And then it also kind of takes your mind off of what you're doing, if it is not something that you typically would enjoy. And that can also be even maybe like a little dance break, whatever you like to do, but do something for your little workout. And then for those managing like high blood pressure, think about like small frequent efforts. So those daily movement patterns, the daily movement matters more than those occasional hard workouts. Again, consistency. So we really want to focus on that. Dr. Block touched on nutrition a little bit as well. So I did want to bring this in here very briefly. It plays a pretty big impact on your heart health as well. But just know that nutrition basically is just going to reinforce all of the efforts that you're already putting in. So when you think about fiber, your omega-3s, and hydration, to really amplify the heart benefits of training, right? Just remember, it is all one connected system. We are all one being. So everything plays a part. Okay, so pair your movement with some mindful nutrition to multiply those heart benefits. Whole foods, we mentioned, try to stay away from all the processed stuff. Hydration is key. We want to make sure that we are hydrating ourselves. And then, again, consistency. So those simple shifts that really keep your cardiovascular system strong. All right. So heart health is not about perfection. It's about having a direction. And by that, I mean having a goal that you are seeking out and wanting to reach, and then having some small actions that are done consistently to create that long-term protection. So this is a really good diagram here. The ladders are the same height, right? You have one ladder that has multiple rungs. You can look at that as goals. And then you have the other ladder that they have huge spaces between each rung of that ladder. So they might have some pretty big, lofty goals that they want to reach to get to that maybe end goal of longevity, right? It's a lot easier to take those small steps than to try and reach really big for that big overarching goal. And then you tend to get overwhelmed. You have more chances of something coming up. And it could be, again, kids' schedules, right? Maybe your kids, are playing a new sport, or they have something going on at school. That can completely derail your progress or your goals if you are looking at this as one big step instead of taking those small steps and just one thing at a time, right? So I want you to begin with one promise to your heart this week, whether that is a short walk, it's a mini workout, whatever it is. I want one small promise that you can make to yourself this week that you can then build on from there. And that ultimately is how real change is going to happen. So we timed this perfectly because I wanted to allow 10 minutes for Q&A, and we're at 2:50. We have 10 minutes. So I welcome your questions. I am going to stop sharing my screen. I know there were some questions in there for you, Dr. Block, as you were presenting. If we want to address those.
Sure, we certainly can. My video should be working. So first question from Therese, does having kids also impact hormones and changing in women? So yeah, when women, are going through pregnancy, they have usually major surges in estrogen and progesterone, and it suppresses basically the hormones in the brain called LH and FSH. It also can affect other functions, as in cortisol levels and other stress hormones that come out of the adrenal glands. Once the placenta and the child is delivered, the brain basically has to recalibrate. So the hormones that are coming from the hypothalamus and pituitary usually have to regulate. I think, well, I don't know if there's significant data to help us understand what specifically is happening. I have seen multiple patients over the years that after a pregnancy with that major shift or adjustment in hormones is that it never seems like things come exactly, right again. I think that sometimes for women that are having potentially children either later in life or a little bit more sensitive may have some challenges with normal ovulation and normal hormonal balance in the first place. But we have seen it. We have seen it before. And sometimes that just indicates that we need to do a little bit more hormonal work if it's causing some major symptoms. I think there was another question here as well from Brianna. For those of us on GLP-1s with significant weight loss over the past year, does that also impact labs and being able to see changes in signs of perimenopause, menopause? Well, GLP-1s have a lot of really interesting function. So those medications were originally, discovered in the 1990s and were used until just a few years ago, mainly for type 2 diabetes control when there was problems with insulin resistance, meaning that the body is trying to catch up with the amount of sugar and making more insulin, and then the cells are just not really listening to it. The GLP-1s, are basically a form of peptides that signal in both the gut as well as up in the brain, and have a lot of different physiological functions, and as well as not all GLP-1s have the same exact ability to function the same. With the GLP-1s, though, we do see, significant weight loss, slower time for the stomach to empty. So usually smoother glucose loads into the intestines and into the bloodstream. A lot of times these will help mediate some of the times that women will see changes because of the estrogen. Again, there's a lot of moving parts with that, so it's hard to predict, what you would necessarily see. We have seen, and there's nothing in the literature that we have been able to discover yet, but we have seen that for some women, especially with using tirzepatide products, that we've been able to help with some of the perimenopausal symptoms of like hot flashes and such. We're not quite sure what my conjecture is most likely because that specific GLP-1 has two mechanisms of action. It has a GIP action, which is another class of medications that may also have some more brain function, is that maybe it's potentially helping regulate some of the, we call it the HPG axis, the hypothalamic pituitary gonadal axis. So maybe potentially helping with ovarian and other hormonal balances. So, again, you've got something that may help with one change, and then going through perimenopause and menopause leading to other less, desirable or more challenging changes. It's hard to say, but yeah, potentially can help mitigate some of those symptoms for sure. There's my screen.
And then we have one more from Adam. Okay. How can you tell if you're having anxiety or potentially something more significant?
That's a really great question. It depends typically on how, basically, trying to tease out all of the things. A lot of symptoms of cardiovascular symptoms with palpitations, chest tightness, and such can very much be mimicked by anxiety. Usually what we have to do in order to differentiate the two is really consider some testing. If you have anxiety and a lot of stress, it actually does increase cortisol levels in the body. It'll increase your blood pressure and your heart rate. And so it will strain the cardiovascular system. The difficulty is when you've got a combination of the two. Usually it's making sure that you're sitting with your, healthcare team and going through all of the things that we do need to look at, looking at heart health, looking at blood pressure, looking at sleep and diet and exercise, and then being able to tease out the difference. A lot of times, if you've heard of, we can look at an EKG to look at basically the heart muscle and look at the electricity that's running through it to see if there are any signs or symptoms of that. A lot of times when we're having to differentiate between anxiety and chest pain that we think could be cardiac is when we start doing more advanced testing like stress testing. Basically, we are forcing you to exercise your body, and then we actually monitor the heart's response in terms of oxygen, electricity, and sometimes that will give us a clue as to whether or not there's something more sinister about that we need to take care of. So good questions, very complicated answers, but usually it's starting with getting the right help that you need in someone who's in your corner and then evaluating
that. All right, then the next one from Sarah. So this is a question I get all the time. Strength training before cardio or cardio before strength training, which is better if you're doing it on the same day? Cardio is always going to come last. Reason being, you are lifting heavy weight. We do not want you to be fatigued when you have weights in your hands or on your shoulders. So anytime you're doing a loaded exercise, we want to make sure that you are doing that first, and then you can do the cardio after. And that's purely from a safety standpoint. We want to make sure that you don't hurt yourself. But you can do cardio in the morning if you want, and as long as you have time to recover and rest, and then maybe do strength training later in the day, that's totally fine. So in that sense, it doesn't matter which one you do first, unless you're doing them back to back. That's when you want to do cardio last. Yeah, but great question. And then Dr. Block, if you want to answer that last one.
Sure. So Adam's asking, is the calcium score test still a good measure of future risk, or has that been devalued in recent years? That is a really interesting topic, and one that is really interesting to watch the data and testing. So a calcium score is usually it's a CT calcium score of the heart. What we're doing is we're doing a low dose CT scan that's very quick, that takes a look and is trying to capture any clear signs of hardened plaque or calcified atherosclerosis in the blood vessels around the heart. It's a cheap test. And that's why usually when it first came out and we were starting to do it pretty consistently, it was about $99. Now I'm seeing that those prices are usually at least under $200. That gives us a snapshot as to whether or not I can say is there evidence that there is atherosclerosis around the heart or not. The amount of calcium lets us know usually how much we're taking a look at. What we are finding as technology has evolved quite a bit over the last decade is that the calcium score and the calcium that we're seeing in the blood vessels, while it does indicate that there is atherosclerosis, that we're actually looking at the absolute safest form of plaque formation in those coronary arteries. What we're not able to see with the calcium score is the soft or semi-soft plaque that builds up in those. So we can't catch it on X-ray, we can't catch it on CT. And the soft or semi-soft plaque is actually the highest risk and the stuff that is most likely going to break off and cause a clot or a stroke or a heart attack. A lot of our advanced testing today is doing something called a CT angiogram. So instead of a quick CT calcium score, which doesn't require contrast, we're administering contrast and actually watching it go through the heart chambers and actually being circulated through the blood vessels of the heart. The CT angio gives us a certain level of data for flow. And then there's another level of technology on top of that that is now starting to use AI software to calculate evidence of soft or semi-soft plaque. So one of the two major companies out there, one is called HeartFlow and the other one is called Clearly with two E's. That technology is really fascinating and watching it develop and has some pretty robust correlation, but it can actually use the very individual pixels of radiation that we send out in the CT scan, and it can build a pretty accurate 3D image and help us determine how much hard plaque, semi-soft plaque, and soft plaque there is, and then really give us some more advanced risk stratification for what do we need to do as next steps. This becomes important because the only other way to truly know if there is, a clogged artery, so to speak, is to do a cardiac catheterization. So basically, we send in a tiny little catheter, or basically kind of like a hose, into the blood vessels of the heart, usually through either the wrist or the groin. And we have to deploy contrast in a lab while the patient's on the table and actually see if we can find a blockage. So we now have ways where we don't have to use invasive procedures. Sometimes we have to, especially if you're having an active heart attack. Sometimes we will employ that. But it's helping change the discussion that we have about atherosclerosis being, proactive. What do we do from a medical standpoint? What are all the things, if lifestyle is enough to change things and change risk for individuals, or if we have to be more aggressive. So there's definitely a lot more data to come. It's pretty rapidly evolving. The calcium score helps us with the initial question to answer: do we need to consider statin therapy? Statins, while they are unfortunately a very feared class of medications, are one of the least expensive medications that we have to really improve overall health. They actually will help lower inflammation on the inside of those blood vessels, which is really cool. So they don't just lower cholesterol, but they help with that endothelial protection. And so the calcium score helps us answer that question really quickly if we're just looking at, is there evidence that we, absolutely need to start the medication? So yeah, very good question. It's not a bad place to start. But yeah, there's definitely more data out there.
Awesome. Well, we are just over time. I appreciate you all joining us and learning a little bit more, hopefully learning things that you can do to really help with your heart health and ultimately live a longer, healthier life. Um, so again, thanks for joining us today. Next month is going to be talking a little bit more about your pelvic floor health with Dr. Ashley Lytle. So stay tuned for that registration as well. It's the same link that you used to register today if you guys are interested in that one next month.